Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again for Health Professional Radio. Alzheimer's disease is the most common form of dementia, affecting about 6 million people in the United States. Now, historically, it's been difficult to identify the risk of Alzheimer's or to treat it, but that's starting to change. There's a simple blood test providing a new way for doctors to detect potential risk of Alzheimer's disease in its early stages. And experts say that this test could dramatically transform everything from how the disease is diagnosed to how it's researched and even treated in the future. Here to talk about this groundbreaking new approach is Dr. Michael Racke, board-certified neurologist and medical director of neurology at Quest Diagnostics. Welcome to Health Professional Radio, Dr. Racke.
Hi, Neil.
Tell us a bit more about these recent advancements that help detect if you might be at risk for Alzheimer's disease.
Alzheimer's disease is a neurodegenerative disease where two proteins called beta amyloid and tau accumulate in the brain. These turn out to be toxic to the brain, and that results in the loss of nerve cells, and subsequently it affects cognitive function in an adverse way. Recently, two medications have been approved by the FDA that are able to remove amyloid from the brain. And so it became very important to be able to detect who is putting amyloid in their brain. Now, it used to be that Alzheimer's disease was a disease that could only be diagnosed at pathology after a patient died. Subsequently, there was a test called a PET scan that was a radiologic test where you could actually identify amyloid in the brain. And subsequently, one could do what's called a lumbar puncture and remove spinal fluid to be able to determine whether somebody had Alzheimer's disease. It's only been in the last year that we're now able to determine that a patient is putting amyloid into their brain by doing a blood test. And a blood test, of course, is much more convenient for the patient, and it's also much less expensive. So it allows people to identify, physicians to identify people who may be candidates for these new treatments for Alzheimer's disease.
So how does this new blood test actually work to identify the risk of Alzheimer's early?
So we at Quest Diagnostics have a blood test called AD Detect that measures the beta amyloid ratio. And to put it simply, one of those peptides of amyloid goes into the brain and forms what we call the beta amyloid plaque. And so when one measures that ratio in the blood, it becomes lower. And the interesting thing is that amyloid is being put in the brain probably 20 years before someone becomes symptomatic for Alzheimer's disease. And so that's allowing physicians already in clinical trials to identify people who are at risk for Alzheimer's disease long before they actually manifest the clinical signs of the disease.
Is this amyloid a result of diet or lifestyle? What causes this amyloid to present in the brain?
So that's a great question. So we actually think that having some amyloid is a good thing. But what happens is, and it's not really clear why that amyloid starts getting put into the brain, but that amyloid then results in toxicity, the formation of these things called tangles that actually kill neurons. And it's those loss of the nerve cells or neurons that results in people having difficulty with their thinking.
Now, as far as difficulty with thinking, that does extend to physical function as far as walking, chewing.
You know, it's interesting that you say that. I would say early on that people have problems with recent memory. And I would say things like registering, that if you're having a conversation with your loved one who keeps asking you things, the same question, a question that you just answered a couple of minutes before, that's a very strong characteristic of Alzheimer's disease. Misplacing things like the keys, getting lost when you're driving a route that you're very familiar with, those are all characteristics. It turns out that when you get to the end stage of Alzheimer's disease, then you're exactly right. These people become so severely affected that they can no longer take care of their activities of daily living. But that's really at the end stages of the disease.
What would you say to the folks who are afraid to talk to their doctors?
That's a very good point. I would say that, even a few years ago, there really wasn't much we could do for Alzheimer's disease. There were a couple treatments, but they weren't very effective. These recent drugs clearly slow the progression of Alzheimer's disease. We have 2 drugs that are approved by the FDA, and we anticipate a third to be approved next year. There are over 100 drugs that are in clinical trials right now. So I anticipate within the next few years that we're going to have lots of options for treating people with Alzheimer's disease. And so it's going to be a very different landscape from what people thought of in terms of this anxiety about getting a disease for which there was no cure.
You mentioned a major symptom. You said tracking or registering. What symptoms should we be looking for when we think that maybe just being a little bit forgetful is what's going on? Because that is possible. We all get forgetful from time to time.
Right. So I remember being taught that there was something called benign senile forgetfulness, right? Mm-hmm. But I think this goes a little bit more than that. When you actually keep having the same questions asked over and over again, when you, as I mentioned before, something where a routine that you do all the time, and all of a sudden you have difficulty remembering exactly how to do a task that you did for a long time. And sadly, this is often something that people recognize at work. It's something they used to do for years as part of their routine. All of a sudden, they find it difficult to do. But sometimes people who are getting early signs of what we call mild cognitive impairment, that they notice, or family members notice these things before the patient does. And so maybe it's the family member who says, maybe we should go see a doctor and get this evaluated. And that's where we at Quest Diagnostics have this blood test called AD Detect, the beta amyloid ratio, that helps with the physician evaluate whether these people are not only potentially developing Alzheimer's disease, but whether they might be a candidate for some of the new treatments that are now becoming available.
What do you see for the future of treatment and testing of Alzheimer's? And then give us a website where our listeners can get more information.
So there are over 100 drugs that are in clinical trials. So right now, everything that's approved is removing amyloid. But there are going to be treatments that are going to remove tau. There are going to be treatments to try to modify the enzymes that produce those toxic proteins. And so I think there's going to be a lot of different ways that we approach treating Alzheimer's disease. Again, I think it's important to speak with your doctor if you think that you or a family member might be having some of these issues. And for more information, one can go to questforthecure.com.
Michael, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio.
My pleasure, Neil. Thank you.